Hi, my name is Lisa Marley, and I'm doing my case study on arteriovenous fistulas. The presenting symptoms for an arteriovenous fistula would include red swollen skin and purplish blood vessels, bulging veins seen through the skin, swelling of legs or arms, decreased blood pressure, heart failure, fatigue, and fecal occult blood loss. Often, though, fistulas do not have any signs or symptoms. But typically the image findings is going to be an abnormal connection between an artery and a vein. An arteriovenous fistula is an abnormal direct opening between an artery and a vein. It sometimes results from accidental penetration to the skin, such as a gunshot or stab wound, or even sometimes from vascular diseases or from congenital by origin. A genetic condition that can cause arteriovenous fistulas is called Osler-Weber-Renau disease, and it causes blood vessels to develop abnormally throughout your body, but especially in the lungs. As a result of having an arteriovenous fistula, the arterial blood is passed to the venous side of the fistula, and the blood pressure in the vein increases, causing distension. People who have had late-stage kidney failure may have an arteriovenous fistula surgically created in the forearm to make it easier to perform dialysis. This first image is in 2D, and you can see where the superficial vein and the radial artery connect at the arteriovenous fistula. Here you can see a Doppler ultrasound in a transverse view of an arteriovenous fistula between the right radial artery and the cephalic vein. In this Doppler ultrasound, it shows a sagittal view of the arteriovenous fistula connecting the radial artery to the distal cephalic vein. In addition to certain genetic or congenital conditions, the following risk factors may make you more likely to develop an arteriovenous fistula. Those include a cardiac catheterization, especially if the procedure involves blood vessels in your groin. Other factors are certain medications, including blood thinners or medications used to control blood flow. Others include high blood pressure or high body mass index, as well as older age. If left untreated, an arteriovenous fistula can cause complications, some of which can be very serious. That would include heart failure, blood clots, leg pain, or bleeding. Heart failure is the most serious complication of large arteriovenous fistulas. Blood flows more quickly through an arteriovenous fistula than it does through a normal vessel. As a result, your heart pumps harder to make up for the increase in blood flow. Over time, the increased workload on your heart can interfere with how the heart will work, leading to heart failure. An arteriovenous fistula in your leg can cause blood clots to form, potentially leading to a deep vein thrombosis, which is a painful and potential life-threatening condition if the clot were to travel to your lungs, which is called a pulmonary embolism. Depending on where your fistula is, it can lead to a stroke as well. An arteriovenous fistula in your leg can cause pain that is called claudication, or can worsen the pain that you've already had present. An arteriovenous fistula can lead to bleeding in your GI system as well. Here I wanted to show an illustration of the different types of fistulas that are possible to form. At an appointment, your doctor will use a stethoscope to listen to the blood flow in your arms and legs. The blood flow through an arteriovenous fistula makes a sound similar to humming. If your doctor suspects a fistula, you'll have other tests to confirm your diagnosis. Those would include a duplex ultrasound, CT angiogram, or a magnetic resonance angiogram. Duplex ultrasound is the most effective and common way to check for an arteriovenous fistula in your legs or arms. In duplex ultrasound, sound waves are used to evaluate the speed of blood flow. A CT angiogram can show if blood flow is bypassing the capillaries. Before the test starts, you'll receive an injection of dye, which is the contrast that makes your blood vessels show up more clearly on CT images. Your doctor may use the magnetic resonance angiogram if they think you have an arteriovenous fistula deep under your skin. Like an MRI, an MRA also uses a magnetic field and radio waves to create pictures of the body's soft tissues. However, you're also given a special dye that helps create images of your blood vessels for this specific modality. For treatment, ultrasound-guided compression may be an option for you if you have an arteriovenous fistula in your legs that's easily seen on ultrasound. In this treatment, an ultrasound probe is used to compress the fistula and block blood flow to the damaged blood vessels. This procedure takes about 10 minutes, but it only works for about 1 in 3 people. For a catheter embolization procedure, a catheter is inserted in an artery near the arteriovenous fistula. Doctor uses X-ray and other images to guide the catheter to your fistula. Then a small coil or stent is placed at the site of your fistula to reroute your blood flow. Many people who have catheter embolization will stay in the hospital for less than a day and can resume daily activities within a week. Large arteriovenous fistulas that can't be treated with catheter embolization may require surgery. The type of surgery you'll need will just depend on the size and location of your arteriovenous fistula. Here in the slide, I also wanted to show an illustration of the different types of fistulas that are possible to form, as well as for the differential diagnoses of an arteriovenous fistula could include other conditions that may cause hyperdynamic circulation, like an increased heart rate, increased cardiac output, and low peripheral resistance. Other differential diagnoses can include cirrhosis, hyperthyroidism, Paget disease of the bone, and occasionally very large, highly vascular tumors like sarcomas that should be considered. And here are all my references.